Welcome to Season 3 of On the Spot.
In our discussion last week on mental disorder, substance abuse was cited as one growing factor leading to the issue of mental disorder. Now, this is why we're having this conversation again tonight. Now, the Institute of Security Studies states that the number of drug users in sub-Saharan Africa is expected to increase by nearly 150% by 2050, based on its research by the ENACT program. This creates new issues around law enforcement and criminal justice, while placing public health systems under enormous stress. High levels of poverty and the inequality remains a significant factor fueling this rise. In our Season 2 conversation, we had a guest from the National Drug Law Enforcement Agency who shared the many challenges around fighting substance abuse with a rehabilitated user, sharing what it is like being an addict. Well, you can catch that episode on our YouTube channel, On the Spot with Stella. So what has been the progress made so far since that interview? Habib Tago Kamara returns on the show to tell us where we are in this fight. He is the Executive Director for Social Linkage for Youth Development and Child Linkage. Well, he is also the Vice Chairman of the Sierra Leone Alcohol Policy Alliance. Welcome back to the show, Habib. Thank you for joining us yet again.
Yeah, thank you very much, Stella, and On the Spot. And so many things has passed through since our second season.
Absolutely.
Yeah, I am now the current chair of Sierra Leone Alcohol Policy Alliance.
Wonderful. Congratulations, first of all.
Yeah, thank you so much. We are trying to have an alcohol policy that will inform the populations for policy, but presently for the substance abuse, and since that time to now, substance abuse has been increased.
On the increase?
Yes. And
why so?
Why so? We have drugs that were not on the street that are now on the street, as the Kush pandemic or the Kush indica is now all over the streets in the country, and a lot has been done by stakeholders. I want to thank the ECOWAS for providing 40 bedrooms for Sierra Leone for drug rehabilitation. And as I speak currently, there is a training undergoing for people that has to be working along those lines. And ECOWAS is really having the zest because of, you watch the paradigm shift now in the sub-region.
Yeah.
Younger people that we are taking marijuana have now shifted from marijuana to Kush. All of us saw the documentary that came from BBC about Kush, and it is very worrisome to this country. If stakeholders or like-minded Sierra Leoneans could not put things in place, we lost a lot of people in terms of their reproductive health, HIV, and other vulnerable diseases. We are still in COVID, and nothing towards reaching out to those drug users has been done by even the COVID response team in the country.
Now, that is a concern because from last year when we had you and the guy from NDLEA and even the drug user, 1 year down the line, there is clearly no progress, aside from the intervention from the ECOWAS, which is a step in the right direction. But unfortunately, from what you're saying, there is rather an increase in drug use. Why is that so?
Why is that so? Is based on the budget finances to the NDLA. NDLA is the organizations that has the right to regulate drug-related issue. I follow them. The budget that they presented to government for them to administer their activities. It was 5 billion. But it is a disappointed to this country. It was about 500 million that was agreed by the finance minister, the finance ministry, that they will support that entity. As I speak, government is still making lip service in terms of drug-related issues. This country who do not really want to invest in terms of drugs. Our government is spending about 23.1% of our GDP on free quality education. If we want that investment to hold, we have to invest in drugs, because those that we are investing for them to acquire education, majority of them are on drugs. So that is the reason I'm bashing on government. More especially, government is not seeking serious issues in terms of those substance abuse who have a lot of violence. Guys that are on drugs are unemployed. And if they are unemployed, anybody that will come to them with a pittance for them to do anything, they will do it. And again, there was a seizure of cocaine, which was trafficked from Freetown to Burkina Faso. It passed through Guinea, Mali, and up to Ghana to Burkina Faso. So we are now envisaging that drugs are still coming to Sierra Leone. And research has said from the West Africa Drug Commission that majority of the drugs that are now coming to West Africa are not now being trafficked to the Americas or other places.
They're now being used.
They are now being used in our country. And we are seeing it with people. So the supply route, which government really needs to put emphasis on, they are not putting emphasis on.
Let me hold you there on the supply route, and we'll come back and continue the conversation. This is On the Spot. My name is Stella Bangura. We'll be right back.
Anti-Corruption Commission, ACC, is the leading institution in Sierra Leone's effort to combat and control corruption. Our dedicated team is committed to preventing corruption through public education, rigorous investigation, and prosecution, which has seen Sierra Leone make remarkable progress in the anti-corruption ranking. We climbed 22 places in the Transparency International ranking and score over 70% for 6 consecutive years in the Millennium Challenge Corporation Scorecard. ACC operates toll-free hotlines for reporting corruption and ensures protection for informers and witnesses. We also establish solid whistleblower protection and reward scheme to recover ill-gotten gains. Together, let's fight corruption and uphold integrity for a better future.
Welcome back to the show. We're talking about dealing with substance abuse. And my guest from last year, Habib, joins me again, of course, to continue the conversation. 1 year down the line, what has been the progress? And from our conversation, there has been no positive progress in that fight. So are you saying, Habib, that Sierra Leone is now a transit point and a major user of illicit drugs?
Yes, and it is evidence-based, and it is in our community. If a seizure was done in Burkina Faso and that drugs came in from Freetown, what I want you people to know, drug is the third largest commodity that has money.
Yes.
And the cartel has money than most of the West Africa government.
So let me ask, is there a cartel in Sierra Leone? If yes, do we know them?
It must be a cartel, because if drugs is being transited from Sierra Leone, there must be a cartel in Sierra Leone that is doing this work, that is transiting this work. Again, and the supply route, in terms of drugs, we have 3 areas that has to lay emphasis on, which is the supply route that I was talking about, with the drug and demand reduction, which the National Drug Law Enforcement Agency, that is their own jurisdictions to deal with demand reduction, taking demand reductions to every corner of this country. The last one is harm reduction, which my organization is doing, removing harm from the drugs that drugs users are undertaking. And government is not paying more attention towards the demand reduction or the supply reduction.
Why? Why do you think so?
Why do I think so? We could because the increase in the substance abuse in the country. Every day there are new drugs in the streets. Now there are 2 drugs in the street now, apart from Kush. There is what we call Thailand, and there is what we call Spark 5.
Is it?
But yeah, these are tablets and capsules that are in country, and they are coming from Asia. And the supply route of these drugs, they comes through our high seas. And based on research and based on investigations we are making, they come through these fishing boats that we have with these Asians, the Chinese, the Thailands, and Koreans.
So if we know the channel through which they are getting into Sierra Leone, is it that government is not paying attention to the issue of substance abuse, or are they oblivious to the fact that there is a substance abuse issue in Sierra Leone?
Substance abuse issue in Sierra Leone, everybody knows that there is a problem of substance abuse use in Sierra Leone. And talking about government is not paying more attention, I can say so because if it is a short economics, the higher the demand, the lower the supply. If the supply is higher, if the supply is lower, you can see the demands reduce.
Yeah.
But in this country, every year you go, every corner you go in Sierra Leone, you have access to drugs. And there is an entity responsible to do that. I can give kudos to them, the National Drug Law Enforcement Agency. They have launched their strategic plan. And on their strategic plans, they have a plan to review our drug law, which came into being in 2008. And when the cocaine plane landed from Venezuela to this country, by then, Sierra Leone do not have any act or any law to try those that came with that cocaine plane. But the then parliament rushed and to give us an act under a certificate of emergency for 2 weeks. So from that time, we as civil society organization, we say that, and due diligence was not given to the users. In this country, users are the ones that has problem. Whenever there is a drug raid, or whenever they say they have arrested people with drugs, it is the users. For us, the users need more public health attention, criminal justice attention, than taking them into incarceration, leaving the supply route.
What is the medical options available to dealing with substance abuse? And I'm going to hold you with that question. We'll take another quick break and we'll be right back. This is On the Spot.
Who knows what might happen tomorrow, next week, or even next year? But we do know that with Staco Insurance, whatever the future brings, we'll be there when you need us most, with outstanding customer service and prompt payment of your claim. Fire, motor, general accident, marine, life and medical. For now and for tomorrow. Staco Insurance, a passion for high standards.
And we're back. The conversation is on substance abuse. And we left off on the medical options that we have with dealing with substance abuse, because dealing with it is a holistic process. It's a holistic approach. Do we have that capacity to deal with it?
That capacity is not present in the country. We are supposed to have a methadone unit. Methadone is something that rehabilitates people that take substance abuse, people that are addicted to substance abuse. But presently, I am working in hand with the UN, ODC, which is the National United Nations and Office on Drug and Crime, for us to have a methadone unit in this country, and even my donor, the donor that is sponsoring me, to reach out to the injecting drug users, which is the global fund for us to have a methadone clinic in this country. Somebody that is being addicted to drug, and psychosocial counseling cannot make that somebody to become rehabilitation.
Absolutely.
It is just a package. But we're supposed to have a methadone unit that people will be taking it for them to be dispersed, because presently we do not have it. And the only other options we have, I am working with injecting drug users on the HIV and intervention, HIV response in the country. We supply clean needles and syringe to those that use needles and syringe, not for them to exchange it. Research has revealed that people that inject drugs are 38% at risk of getting the HIV and hepatitis. So, and we are giving clean needles. And again, there is a drugs for overdose.
Do we have it here?
You have, yeah. Presently, we have a consultant that is in country that is working with my organization with the national and HIV program, the NACP, for us to have a naloxone. It's an overdose therapy for those that are overdosed from drugs. Now, the problem we are facing in Sierra Leone, majority of the younger people that are on drugs are on overdose. And overdose is something that kills people.
So with this scary reality, how then do we manage cases of substance abuse in Sierra Leone, given that we clearly don't have any structure to address it?
We only have one facility, which is the Kisi Psychiatric Hospital. And drug rehabilitation and mental health issue are closer related, but they are two different ways how we administer to drug users. And as we speak, we do not have a rehabilitation unit or medications to rehab people from drugs. What later we have noticed, people that are that have drug problem, and they are taken to the Kisi mental home, when they introduce them to Lagatine. Lagatine is for mental illness. Disorder. When they introduce them to Lagatine, it's another substance for them. And that is the reason, and this is a one whole research which I want you as a journalist to really go around where the Kisi mental home is. Because majority of those people that were having drug-related issue that were admitted into that facility, when they are discharged, because of that Lagatine, they will not go up from that place.
Are you serious?
Majority of the makeshift houses you have within that facilities are people that have substance problem that has started using Lagatine. For people that has mental health related issue, that when they know that this is Lagatine they are coming to give to them, they will become very violent because they know what Lagatine can do to them. Yes. When they take Lagatine, some of them will sleep for nearly either 1 or 2 days. But for those that have substance problem, Lagatine is another drug based on our research, based on our finding, and based on what we have done.
So we have a challenge of dealing with this crisis, a challenge of managing it, a challenge of reducing it. Where then do we start from? I'm going to take another break and come back, and then we continue on with the conversation.
The National Minerals Agency was set up in 2012 by an Act of Parliament, and in 2013 we started operations. We have the Ministry of Mines and Mineral Resources, that by constitution the minister is responsible for the natural resources of this country, but that's the policy formulation wing of the mines and mineral sector. Then we have the NMA, was established to be the technical professional regulatory wing. So if you take it into context, we are actually the custodians of the minerals of this country: diamond, bauxite, rutile, iron ore, chromite, you name it, including the newly discovered minerals as well, which we're still evaluating whether they're in economic quantities. So our job here preliminarily is to ensure that we maximize the benefits all Sierra Leoneans derive from these mineral resources that God has given us.
Welcome back again. So I asked the question, where do we go from here? And I asked that, first of all, for you to give us a clear perspective of what are the dangers of what we are dealing with. How could this, how would this impact the nation, the issue of substance abuse, if not managed and handled now?
If substance abuse issue is not managed now, one, Sierra Leone has to have a very big crime problem in this country. We have to have a security problem, social problem in this country, and even poverty. Because those that are supposed to be learning something are on substance, and they are not doing nothing for their livelihood.
Yeah.
People are supposed to replace us, but those people that are supposed to replace us are on substance. And the danger is in this, it is security. And country that has a lot of drug problem always at the end will be a failed society.
Are we nailing a failed society if we fail to address the issue of substance abuse?
We are getting there because those that are supposed to be in the labor force are on drugs, are not doing anything productive. Production is something that makes countries to become not to fail. But if those that are supposed to be productive are on drugs and there is no alternative livelihood for them, even for us that are trying to rehabilitate or trying to reach them, you cannot talk to somebody to go off from drug, and if there is no alternative livelihood for that person will go back to that substance. So, and this has to be a multi-sectoral approach in dealing with this. All MDAs, all like-minded Sierra Leoneans has to come to play. Now that the National Drug Law Enforcement Agency has a strategic plan trying to push us to review our laws, more hands has to come on deck for us to see that we have a holistic plan how to manage the drug crisis in this country. And again, we are calling on to the Ministry of Health. They need to do a decentralized way of managing drug-related issue. We should have a psychosocial or drug unit in all our district headquarters.
Absolutely.
Yeah. And mental health-related facilities within our health facilities all over the country, because drug is no longer an urban problem. It's no longer an urban problem. It's now a urban and rural problem. You go to even the last village in this country. In my village, which is about 350 miles up from Freetown, I was there 2 weeks ago. And 16 miles from Daru to my village. And that village has about 40 to 50 houses. You have people in there, young guys in there using substance.
So is this a lost cause? Because there are people as well who are watching, or people who are wherever they are, and they actually want to break away from this addiction.
Yes. People want to break away from this addiction. But you cannot break away from addiction if you cannot undergo a therapy or a medication. It is only by the grace of the Almighty that somebody that has been using narcotic can leave substance. You always have that urge. But if you have methadone that I'm talking about, if you have methadone, you become disinterested in taking drugs again. But if you don't have any therapy within you, you do not have any medication within you, you have the urge to go there back again.
So is this a lost cause?
It's a lost cost for now, but it is never too late. It is better for those that are hearing us or those that are hearing my voice. I am always calling upon authorities. Let us take drug issues serious, because drug issue is a pandemic. Drug issue can make a state to become fail, and drug issues can make a state vulnerable. And Sierra Leone is one of the peaceful states within the Africa setting. But if we cannot manage the drug-related setting, drug and unemployment is a crisis. Drug and youth is a crisis. Drug and violence is a crisis, which for us is a concern for the government of Sierra Leone and like-minded Sierra Leoneans, for us to have this national debate.
How do you then support people who are into addiction of substance. How do you provide that support?
I always reach out to people. My office is always open. I have a psychosocial unit. When it comes, when I think that I will not, our facilities cannot treat you, we do referrals to the city of rest. So I'm calling for all Sierra Leoneans, visit 147 N Kande Drive. Kande Drive, that is my office. We have a psychosocial unit, and we have people that are under overdose. We provide medication, which is naloxone.
Okay.
And we are operating in Bo. If you are in Bo, go to 1 Musa Street. And if you are in Makeni, go to 155 Isolini Highway. You can find our establishment there.
Thank you so much, Habib. Yes, it is a concern. And I'm hoping that as a nation, we will take this serious. The possibilities of violence erupting are very high if issues like this are not addressed. Thanks to the work that you and your team are doing, continuously raising awareness and also supporting those who are addicted and looking for support. And this is On the Spot. Coming up next are my final words. In my final words, there is an urgent need to address issues of substance abuse due to the dangers it poses to our economy. There are far-reaching consequences, such as the threat to our national security. It also puts added burden to our already weakened public health system. With Africa's highly youthful population and data now showing a high use of drugs within the ages of 18 to 25, Africa's future is clearly under threat. Organizations like that of my guest now more than ever are needed, with greater attention and funding from the government on issues of substance abuse. Thank you for watching, and till next week when we come back on your show or come back on the show, remember, keep watching, keep talking, keep it on the spot.